When it comes to heart health, apple cider vinegar can be a real game changer in your daily routine. This natural remedy is packed with benefits for your heart, digestion, energy, and more. But here's the catch: most people are using it all wrong. You might be knocking back apple cider vinegar every morning like clockwork, yet scratching your head wondering why you haven't seen any improvements in your heart health, digestion, or energy levels. Well, the reason might be simpler than you'd think. You could be making one of 9 common slip-ups that are keeping you from feeling the full effects. In this video, I'm going to walk you through the biggest blunders people make with apple cider vinegar and show you exactly how to fix them. By making these simple changes, you'll finally be able to tap into its benefits for your heart, kick your energy levels up a notch, and just feel better overall. So, if you're ready to stop spinning your wheels and start seeing some real results, let's jump right in with mistake number 1, using the wrong type of vinegar. Walk into any grocery store and you'll see rows of clear, filtered apple cider vinegar sitting next to cloudy, unfiltered versions with something called the mother floating inside. Most people grab the clear one because it looks cleaner. That clear version has been pasteurized and filtered, which destroys the bacterial cellulose matrices that contain acetobacter and probiotic strains. These microorganisms are what help your gut produce compounds that lower cholesterol by increasing bile acid production. The raw, unfiltered version with the mother also contains polyphenols like gallic acid and catechin that have ACE inhibitory activity, basically natural blood pressure lowering compounds. The cloudy sediment you see isn't contamination, it's the active ingredient. Look for organic, raw, unfiltered apple cider vinegar with visible mother strands. Have you been avoiding the cloudy ACV because it looked less appealing? Wait until you see mistake number 2. This involves timing that could make or break your results. You're drinking apple cider vinegar whenever you remember instead of strategically timing it for most heart benefits. Your neighbor might chug it with breakfast, your coworker takes it before bed, and you're doing it whenever it's convenient. Timing matters because acetic acid works by delaying gastric emptying, which blunts glucose spikes after meals. When you take it 15 to 20 minutes before eating, you can reduce blood sugar excursions by 20% in insulin-resistant people. This prevents the glycemic rollercoaster that damages blood vessels over time. Take your ACV 15 to 20 minutes before your largest meal of the day, or before bed if you struggle with morning blood sugar spikes. Are you taking it with meals instead of before? Mistake number 3 reveals a mixing error that completely cancels out the heart benefits. You're mixing apple cider vinegar with fruit juice, honey, or sweetened beverages to mask the taste. This completely defeats the purpose and can actually harm your heart health. Adding even 25 grams of fructose to your ACV completely negates its lipid-lowering effects. Your liver can't process the mixed signals and ends up storing more fat, which increases cardiovascular risk. The irony is that people add sweeteners to make ACV more palatable, but they're creating a drink that's worse for their heart than doing nothing at all. Mix your ACV with plain water or use it in salad dressings with olive oil. If you need flavor, add a squeeze of lemon or a pinch of cinnamon. Both support cardiovascular health without interfering with acetic acid's mechanisms. Have you been sabotaging your results with sweet mixers? Mistake number 4 involves a dosage error that 90% of people make. You're either taking tiny sips that do nothing or megadoses that damage your heart. Most people have no idea what the therapeutic range actually is. The sweet spot is 15 to 30 milliliters daily. That's 1 to 2 tablespoons. Below 15 milliliters, you won't get enough acetic acid to trigger the metabolic pathways that benefit heart health. Clinical trials use this range because it's the least effective dose for lipid and glycemic improvements. But here's the dangerous part. Exceeding 30 milliliters daily causes hypokalemia, which is low potassium in your blood. This happens because acetic acid increases renal potassium wasting. Stick to 1 to 2 tablespoons daily and never exceed 30 milliliters without medical supervision. Your heart needs consistent, moderate dosing over time. Speaking of time, mistake number 5 shows why most people quit before seeing results. You're giving up on apple cider vinegar after 2 weeks because you don't see dramatic changes. This impatience is costing you real cardiovascular benefits. Your body needs time to adapt to acetic acid's metabolic effects. The cellular changes that improve heart health happen gradually. HbA1c improvements don't become statistically significant until week 8 of consistent use. Cholesterol changes take even longer, usually 12 weeks least. People who stick with it for 3 to 6 months see sustained improvements in multiple cardiovascular risk factors. Those who quit early miss out on the added benefits. Think of it like exercise. You wouldn't expect to get fit after 2 workouts. Your metabolic health follows the same principle. Set realistic expectations and commit to at least 12 weeks of consistent use before evaluating results. Track your progress with actual measurements, not just how you feel. The long-term approach pays off, but mistake number 6 involves a protective measure most people completely ignore. You're drinking undiluted apple cider vinegar and destroying your tooth enamel, which creates cardiovascular stress through an unexpected pathway. Straight ACV has a pH of 2.5 to 3.0, which is acidic enough to strip calcium from your teeth within 30 seconds. Poor dental health is also an independent risk factor for endocarditis and coronary artery disease. The oral bacteria that proliferate in damaged teeth can enter your bloodstream and contribute to arterial inflammation. The solution involves 3 steps. 1. Dilute your ACV to pH 5.0 or higher by mixing 30 milliliters with 240 milliliters water. 2. Drink it through a silicone straw placed behind your second molars. And 3. Rinse with water afterward. These protective measures prevent dental damage while preserving the cardiovascular benefits. Your teeth and heart are more connected than you think. Protect both with proper dilution and drinking technique. Are you damaging your teeth without realizing it? Mistake number 7 reveals a supplement form that's completely worthless. You're taking apple cider vinegar gummies, thinking they're more convenient and just as effective. They're neither. ACV gummies contain only 0.8 grams of acetic acid per serving, compared to 1.5 grams in 15 milliliters of liquid. You'd need to eat 19 gummies daily to get the same therapeutic dose, which would cost you about $200 per month. The maltodextrin binders in gummies have a glycemic index of 110, which means they spike your blood sugar higher than pure glucose. This directly counteracts acetic acid's glucose-lowering effects. You're literally taking a supplement to lower blood sugar while eating something that raises it. Stick with liquid ACV if you want real cardiovascular benefits. The convenience of gummies isn't worth the complete loss of efficacy. Have you been wasting money on ineffective gummy supplements? Mistake number 8 involves a basic misunderstanding about what ACV can do. You're treating apple cider vinegar like a secret cure instead of understanding its specific limited mechanisms of action. ACV helps with blood sugar control, cholesterol modulation, and mild blood pressure reduction. That's it. It doesn't reverse coronary artery disease, repair damaged heart muscle, or prevent heart attacks in people with advanced cardiovascular disease. People with established heart disease often reduce their medications or skip doctor visits because they think ACV is protecting them. This is dangerous. ACV cannot replace proven cardiovascular medications like statins, ACE inhibitors, or beta blockers. Use ACV as part of a comprehensive approach that includes proper medical care, regular exercise, stress management, and a heart-healthy diet. It's a helpful addition, not a replacement for proven treatments. Are you putting too much faith in a single supplement? The number 9 mistake is the most dangerous of all. You're taking apple cider vinegar with warfarin, aspirin, or other anticoagulants, creating a bleeding risk that could be fatal. ACV inhibits platelet aggregation through COX-1 enzyme downregulation. This is the same mechanism that aspirin uses to prevent blood clots. When you combine ACV with prescribed blood thinners, you're getting additive effects that can cause dangerous bleeding. The acetic acid also enhances the absorption of warfarin, making your blood thinner more potent than intended. I've seen case reports of people ending up in emergency rooms with gastrointestinal bleeding after combining ACV with their prescribed anticoagulants. The doctors couldn't figure out why their blood wouldn't clot properly until they revealed their supplement use. If you're on any blood thinning medication, avoid ACV completely or work with your doctor to adjust your dosing. Your life depends on proper blood clotting balance. These 9 common mistakes explain why so many people get disappointing or dangerous results with apple cider vinegar. Remember, it's not just about adding ACV to your routine, it's about using it the right way to truly make a difference for your heart and overall health. But apple cider vinegar isn't the only thing that can impact your cardiovascular health. Up next, don't miss our eye-opening video, the 6 drinks secretly damaging your heart. You might be surprised at what's lurking in your glass. If you found this helpful, don't forget to like this video and hit that notification bell so you never miss out on the latest ways to protect your heart, one smart choice at a time.